Well, good morning, everybody. Thank you. Sorry for the late start for the webinar. We had a few technical glitches that we were working through, but we're so grateful you can all join us. My name is Mark Stanton. I serve as President and CEO of the Scottsdale Area Chamber of Commerce, and I'm so grateful to all of our members and stakeholders that have joined us on the call today. And we've got a strong panel discussion. This is a continuing series of updates we'll be doing over this next couple of weeks, as the Chamber looks to provide content and information via the new platforms between the digital, Zoom, and conference calls. We'll be putting out new schedules for our regular programs, such as the Economic Development Advisory Council and the Public Policy Council, to our members, as well as our AM and PM Connect programming and Meet Your Neighbor programs. So this is part of a webinar series. We're very fortunate. Earlier this week, we had Congressman Schweikert talking about the SBA stimulus program. And today we're going to be talking about public safety update, and an update starting off with the mayor and then moving over to Chief Rodbell and Chief Shannon about public safety. One of the housekeeping tips we want to pass along is we will be taking questions and providing answers to the panelists. All you need to do to ask a question is at the lower part of the screen, you'll see an icon called participants. If you click on that participant icon, you'll see it says raise hand. If you raise your hand, just click that, raise your hand. A colleague, Brittany Bolton, will be monitoring that, and she'll call on you by name, and that'll give you the chance to ask all the panelists or an individual panelist a question that you might have, and then she'll automatically lower your hand and take the next question in line. So we have, again, a great program. I'm very grateful. Mayor Layne has been very strong in communicating updates to the stakeholders and getting information out to the community, and he'll lead off our discussion today. And welcome, Mayor Layne.
Thank you, Mark, and thank you to the Chamber for all the help and work and partnership you've had with the City of Scottsdale in this entire effort. So it's a very, very meaningful relationship that has served, I think, our entire community very well. So thank you very much for that and the opportunity to talk to your group. This particular session is a great deal about public safety. Obviously, that's the other two panelists are here. So I'm going to focus a little bit on the structure of how this all comes about, if that's suitable, I think, for this audience. I'm just going to start with the fact that, of course, when the COVID-19, the coronavirus came upon us, the president ended up with an emergency health declaration in a federal form. And that was followed by the governor, of course, and the governors across the country in filing their own emergency health declaration, followed by the municipal leaders, including myself, who issued a declaration of emergency. All of those things enable our community to do certain things that would normally be outside the realm of our civil liberties and potentially more intrusive than government normally might be, and more directive on certain things to face the disaster at hand. And so that, to start with the fact that the city's immediate issue right now, and frankly, not only issue, but its mission right now is to follow well, number one, as it is for all of us across the country, is to slow down the contagion of COVID-19 in an effort to press down what would otherwise be a spike, which is anticipated in mid-month of this current month, a spike in demand for health services. And if we are not successful in that, it could overwhelm our healthcare services. And that's the one thing we want to avoid, because it brings another disaster upon us when there is a triaging of equipment. And of course, the forecasts that have been made and sometimes adjusted are simply needed because you want to make sure your resources are going in the right places and that you're not diverting resources that are otherwise needed in greater extent or frankly lesser. But in any case, that has been to try to keep that spike and thus the high demand of patients on our healthcare system. So that's what the effort is in all of the essentially in one form or another coming from the federal government. The federal government's role in this partnership is in support, but also in directive and support in all manner of things, but most notably is referred to as financial support and institution and agency support on the federal level. Comes to the governor, and the governor and the state are set to manage it. And that's what the governor has done with his executive orders, 20 thus far in this emergency. And so they have all been tied to trying to serve as to define, to clarify, manage the contagion of COVID-19. And to slow down that person-to-person transmission of the virus to prevent that spike. And of course, in the models that are out there are based upon the information that's available thus far. And so they're in a constant state of some change as we get better and better information. Knowing that initially we did not get complete information from the source in China on some of this, and there were some obstacles with regard to that, and then the implementation of some things. So we're not behind the 8 ball as it is right now, but we certainly started out with some rather difficult information in the way of statistics and data to be able to extrapolate what kind of need there would ultimately be. And that creates created a little bit more panic and concern in the public than may have been warranted. Some of those numbers have been changed and come down. The federal government, as I said before, is here to support us, and they've represented that in many ways. And of course, the CARE Act is a principal example of that in trying to get businesses and employees who have been laid off, of businesses that have been closed, and some who are on the front line of the effort to reduce person-to-person transmission of the disease, and thus be able to suppress that spike. Saving lives is also part of that program too. So it's incumbent upon us all to try to follow those directives, which I hope that everyone has become aware of in the process. So I won't go into that at the present time. So, we all know that unemployment has spiked significantly already. And of course, the number of businesses here in Scottsdale and the number of employees that are now unemployed. Our first point of action really is to make sure that those funds that have been made available by the federal government, that they get allocated, that we do whatever we can to identify, communicate, and assist wherever we can in making sure those businesses recover. Because ultimately, they're going to be essential in a longer term recovery of our city and all that we do here in our city. So the city's role is to execute and enforce. I mentioned the state's role really in managing this, but ours is really to execute and enforce the state's guideline, recommendation, advisories, limitations, and directives from the governor and the president's COVID-19 task force. Every effort has been made to facilitate I'd say a very disciplined and consistent and collaborative team approach with our partners, the federal government and the state in this mission. On the overall, our community has supported and willingly complied to the sections that have been communicated by the governor's EOs and obviously also the consent of the federal directives and guidelines. The governor's recent EO 2020, which has been quite a bit of conversation on, at least in the circles that are noted on it, is labeled "Stay Home, Stay Healthy, Stay Connected." And when the president, and then of course the governor in concert with that, extended the period of time that we would live under the restrictions, and frankly, maybe even tighten some of those restrictions to the end of this month, there was a concern because as this period of potential isolation in our community and from their normal activities and day-to-day would create adverse effect on the state of mind of a number of people. His effort was really to try to remain as normal as possible, but at the same time making sure that we're complying with the guidance of physical and social, what's been dubbed both social and physical distancing. And of course, all of the accompanying hygiene issues that come with those directives as well, in order to try to just make sure we're not communicating this disease between one another, and thus creating more potential folks who are going to contract COVID-19. So one part of that 2020 was a reassertion of some of the things that had been said previously. It did end up closing schools to the end of school term. It adopted what the president had said of 30 days to the end of this month at that point in time. And so those are all included in it, but there was also some additional elements that has really been somewhat overlooked. In his definition and what he's defined through his EOs, executive orders, and was to have essential services and essential activities for keeping our state of mind in a healthy place. So what he's advised and what he's pushing forward provides some essential services that some people might take exception to. But one of the essential activities that he's also endorsed, and we are trying to be vigilant as a community here with our law enforcement and code enforcement, is to being careful that people who are taking advantage of walking and hiking and running in our city streets, but also in our parks, and just being in the parks for some activities, that they maintain the physical distancing and all efforts to try to make sure we're not transmitting that disease between one another. That's been an area that has been some concern for us. The governor did lay out also the fact that there is a statute that exists and has existed for some time as to what enforcement measures we could take for somebody who is not following those prescriptions. And he has also indicated that first time be a warning and ask for compliance. The effort has been that we try to maintain a sense of collaboration with our citizens and working with our citizens rather than coming down too terribly hard, but we still are trying to affect the net result of reducing the transmission and maybe saving lives, but at the same time making sure we avert another disaster if our medical facilities become overwhelmed. In conjunction with all of that, we work with the state and with our healthcare community too, to make sure that their supplies and the things that they are working with are coming through the county. As city leaders and such, we are coordinating in all those efforts. But one of the restrictions that was sort of heightened in 2020-18, the executive order, was that to limit our movement around, stay at home, except for the engaging in essential services. And essential services mean whether you're employed or whether you volunteer or whether you participate with essential services. Those are reasons to leave your home. Beyond that, the directive is to stay home. But essential services are broad in some respects, but those essential services still do have a requirement to maintain the physical distancing and some of the other elements, as I was mentioned before, of hygiene and protection for those they may have to interact with. And it's also limited to how they interact with people, one at a time in some instances. In some businesses that are not essential businesses, they can't receive people in their office, but they can go to their office and work. There's a listed items that are included, so it's pretty comprehensive. But with that, and I think I might be at the end of my time, I would just say that one of the principal things the city has to concern itself with, this is an internal matter, but it's also a physical component of what our city is all about. And you have two representatives here with you today that that are part of what is dubbed critical infrastructure functions. Officially on a federal level, there's 55 of them, but as we've added some essential services and activities that are not necessarily critical infrastructure function. And we're talking about everything from self-defense and transportation and food chain supply, all of those things. But certainly a major one is medical care and first responders and law enforcement. So you've got two that are connected directly with that. But our city also has water supply and even the essential function and essential and critical function of government. So we're required to be here and do the things that meet those demands. And we have to measure ourselves and our resources very carefully. So that is our role in this. And that is our obligation to our community and to our country to play that critical role as far as that's concerned. But we hope to have everybody come through this together. We'll do the right thing. We're going to move together in this mission together. And as Scottsdalians, and I'm sure we'll do just fine. But that's not just fluff. I think we are working hard to accomplish this, and we have a great community that really has done a tremendous job in willingly following the directives and the things that we know to be important in this mission of tamping down the curve.
Thanks, Mayor. We're going to come back. We're going to open up for questions after we finish all three presentations, but thank you for setting the stage and giving us an update on the city from your chair as mayor, and appreciate updates. We'll come back to questions after we finish up with all the panelists. And moving forward, I'd like to introduce Chief Tom Shannon from the fire department. Again, Chief, you've been excellent in communicating to all the stakeholders, and appreciate your ability to join us today. So Chief Shannon.
Well, thank you, everyone, and I appreciate being invited to talk to you all, and happy to answer any questions following our conversation. I thought I'd give you just a thumbnail sketch of what's been going on for really about the last 8 to 10 weeks. Of course, in January or February, we all kind of became aware that there was something going on in China. What really brought it home to us was patient one had a Scottsdale affiliation in that family of patient one in Arizona went to Scottsdale Honor Health, and some of you may be on this call as well, and you may want to speak to that. But that was our first engagement in COVID in the state. Patient number 2 was actually a Scottsdale resident, and that is what caused us to stand up what is known as an incident management team. That incident management team includes everyone in the city government that, as the mayor previously described, is considered critical infrastructure. There are emergency support functions that operate within the emergency management system. And then in peace times, if you will, or when emergency management is kind of just humming in the background, that division reports it to the fire department. But in circumstances like this, emergency management becomes a direct report to the city manager, and then ultimately collaborates directly with the mayor's office. And so our very talented emergency manager, Troy Lutrick, stood up an incident management team that included both Chief Rodbell and myself and our staff, water, certainly community services, economic development, kind of a tight group. Once patient 2 transitioned into a community spread, and if you'll remember, that was about a week before. It took about a week for community spread to be declared. Then we stood up what is really more commonly known as an entire emergency operations center with every single division in the city represented, as well as our key stakeholders from throughout the community. Many of you on this call participate in those 3 times a week calls. And so we have ratcheted up our command and control of our functions. In the fire service, we have about 4 or 5 of those emergency support functions, the primary one of which is called mass care. Mass care really relates to how we respond to emergency medical calls, then ongoing needs of the community in terms of their medical elements, and then frankly, public health surveillance and liaisoning with that. And if it's okay, and we'll hope our technology works, I'm going to share my screen really quickly with everyone and go to, let me go to my, tell me if you can see this, Mark. I'm going to show you, can you see this on the screen?
No.
Okay, let me see if I can pull it up. There we go. I apologize, whiteboard. It looks like it's not going to allow me to do it, but essentially I sent out in a chat form to everyone there's 2 websites that everybody should go to, and one of them, it gives the global perspective, and that we look at that map 3 times a week just to kind of get a global perspective. Sadly, today in the United States, there are 6,605 deaths. There are 258,000 confirmed positives, and it gives. This is from Johns Hopkins University. You might want to go there and check that out. You can look at it from in terms of a real-time sort of perspective. The next website that I shared with you, and I'd hope to bring up, is the Arizona Department of Health Services website, which they update daily. And the number of cases in Arizona is 1,769, sadly 41 deaths. And we are in what is called community spread status. It is entirely likely that with all the mitigating factors that the mayor mentioned, that there will be a lull in the number of cases, an appearance of return to normalcy, and then if predictions are right, there could be another surge. The anticipated impact to the hospitals is somewhere between the 20th and the 26th of April. That is when our hospital partners are really going to need to brace themselves, and many of them might want to comment about that if they're on the line. And so from a fire and public health and emergency management perspective, we are doing what we would normally do in a disaster situation. This is truly a global impact, and so we are, it's not like a hurricane or sadly domestic terrorism where you can really isolate the area and you can throw resources very specifically. So it's very broad, and with that, personal protective equipment has become the thing. We are finding ourselves in just-in-time supplies, and then we will receive a shipment or the potential to lose personal protective equipment very, very quickly becomes part of our logistical priority. And so that is really what we're focusing on, is making sure first responders, to include all of the essential services, both police, fire, water, anybody who's out there providing critical government services, has the ability to protect themselves so that they can continue to serve the citizens. I'm going to let Chief Rodbell speak, and then I'd be happy to answer any questions about the detail of what we're doing, if that'll work for you, Mark.
That's great. Thank you, Chief. Chief Rodbell?
Good afternoon, everybody. And Mark, thanks for doing this. I appreciate the Chamber's leadership and getting some information out and giving us the opportunity to speak to you all. So thank you. As both gentlemen said before, this is sort of unprecedented territory for us. I've been in this business for 44 years. I've been involved in emergency management both on the East Coast and here, and we've never experienced anything like this. And so going and using the same system that we use, the emergency management system, has been a true benefit for us, and we've had some great organization from Chief Shannon and his staff, and so thank you for that. With the police department, as you can imagine, our responsibility is for order maintenance and trying to control any kind of reactions that might occur as a result of a shortage of supplies, a panic in terms of concern for individual health or family health. And you can imagine that you would think calls for service would be going up, and in fact, they're not. Credit to this community, people are doing exactly what's being asked of them. They're sheltering at home, they're maintaining distances, and our calls for service are down about 200 to 300 calls on the average per day. The calls we are receiving, we are looking at whether they have some sort of a contact or connection to the COVID virus. And what we're finding out is that it's a small number of calls for service. The fact that we log or put into our system any use of the word COVID, and that's how we search, many of the calls that come out to us just demonstrate the fact that there really is no real concern of connection or known connection, just questions were asked and comments were made. For example, on Wednesday, we had 8 calls for service in the city where the word COVID was mentioned or a question was made. And of those 8, 5 of those were medical calls. We early on immediately changed our protocols between police and fire, and we said instead of having our officers without the proper protective equipment going into homes or going into buildings where there was a medical call, which we're not really particularly skilled in dealing with, the fire department would go in first and then clear and make sure it's safe for us to come in. I mean, we excluded calls like heart attacks and falls and strokes and SIDS deaths. We were going into those calls without hesitation. But anytime it was simply just a medical call or ill person call, the fire department took the lead on those calls. And that's been a huge benefit for our employees not to have to confront folks that may in fact, be an issue for us. I've had 3 employees that have had contact through other members of their family, having contact with people outside the family. We have not had any confirmed COVID cases in our workforce. And that's really the good news for the city of Scottsdale when you're seeing lots of other major cities talking about their losses in illness and in death of public safety personnel. Our workforce has been very keen to maintain safe social distances, allow the fire department to take the lead on those ill persons calls, and decontaminate whenever we do have to take enforcement action and actually go hands-on with people. And so, as the chief mentioned, our major concern, of course, is protective equipment. The fire department's been terrific in making sure that we have what we need, and if we use something, replacing what we use. You may have seen the not a controversy, but some of the recommendations made recently that not everyone is in agreement on, that everyone should mask up. The purpose of masking up is really about not touching your own face and hands, your face and nose when after dealing with any object, whether it's a car handle, a door handle, or your desk. The recommendation is that you do not touch your face, and some recommendations out there you wear a mask just so it reminds you not to do that. The fire department's been wonderful in helping us secure masks to help our employees feel comfortable and when dealing with just everyday life. If that occurs, the Scottsdale Police Department have a little different look from what we're used to and seeing officers walk around this way. And so we hope to get the word out through seminars such as this, public service announcements, newsletters, any way we can get that information out, that the police departments may have a little different look in the future as we approach and deal with our public. Good news is calls for service are down. Great news is we're still providing that great quality service we've always provided. We're just changing the way we do business. We have to do it online, or we have to do it by telephone, or we have to do it by appointment. But we're still conducting business even though our buildings may be closed. What we're encouraged by as we drive around the cities, and we are making contact with shop owners and others that are out there, we're encouraged the fact that people are practicing safe distances. They are approachable when we comment the fact that we've gotten concerns or complaints from the public that perhaps some places are not practicing safe social distancing, and we've gotten compliance in the vast majority of cases. A few businesses have been relatively difficult, and we have had to go a little stronger in the message, and although I don't think many citations have been written. Hats off to the business community. I can only imagine how difficult and challenging this has been for you all. When this is over, there's going to be a lot of heroes and a lot of stories about heroes out in our community that'll be beyond the everyday known heroes in the hospitals and the streets of law enforcement and the fire stations and out in the public. It's going to be the men and women that are out there working and keeping the shops open so folks can get the supplies and the food and the medicines that they need. Just to get us through this process. And then the folks that decided to shut their businesses down to slow this virus from spreading, hats off to them as well. This is a team effort. We're all in it. The good news is the police department is still doing what the police department's always done. We're not going to become heavy-handed. we're looking for compliance, and I'm very proud to say in the vast majority of our contacts, people have been extremely willing to participate. Answer any questions you might have.
Thank you, Chief. Thanks very much. All three of you, trusted partners and leaders, and I can speak for the chamber how grateful I am that you are continuing an ongoing dialogue with the chamber and giving us resources to offer to our members, and I greatly appreciate that engagement. Moving forward for the participants, this is the time to ask questions of all three panelists or individual panelists. Again, if you look at the bottom of your screen, you'll see the participant tab. Just click on that and raise your hand, and Brittany will call on you for your question and who it may be directed to. So open for questions.
Perfect. It looks like Mike has a question. Mike.
Hello, can you hear me?
We can.
This is Mike Gerstmann with DC Ranch, and I was curious if the city leaders are considering restricting the playgrounds in the parks and the gatherings in the parks. Thank you.
Question is if public officials are restricting or limiting gatherings in the parks.
Mark? Yeah,
yes,
we certainly have the authority to do just exactly that. And one of the things that we have done as a matter of consequence, and the chief may be able to answer toward this a little bit too, but code enforcement and police department are monitoring the activities as closely as we can on horseback, bicycle patrols, and even code enforcement people. And it's not to be oppressive or otherwise. We're trying to give as much latitude as we can without endangering the mission itself. But what we've come to do in those instances where warnings have not sufficed, we have selectively, the city manager, through the city manager's authority in this area, as has been given by the executive, by the declaration of emergency, have actually closed a couple of things. And just most recently, we closed some of the baseball and softball fields and one of the skate parks because it was found that we could not control the situation from the standpoint of physical distancing not being complied with. In fact, maybe even other considerations within that whole hygiene area of things. So that's what we have chosen to do. We have done it very selectively, but at the same time, we continue to monitor the situation. What we're trying to prevent is closing our parks and preserve. If we can get compliance, and it can be on as a matter of some routine that people do abide by it, we'd like to keep them open, because I think for the next 30 days or a little less than 30 days at this point in time, it's going to be important for people to be able to get out and see other people and be able to get around in the healthy air this time of year. We like to think, I think as the governor has stressed in his stay connected portion of it, was to try to make sure that people had an outlet other than just sitting in their homes and going to and from potentially essential service work or getting groceries or otherwise. There's a great deal more exposure in some instances in groceries and other elements of essential services than there generally is if they're out in the open in the parks. So that's been the enforcement part of it, where we're trying to stay away from arresting anybody or even citing. I don't know that, and Chief, maybe you can speak toward that. I don't know if we have issued any citations as of yet, but I do know we took that one step to close the ball fields in that.
Mark, if I may.
Yes, please, Chief.
Yeah, okay. So the mayor is absolutely right, and that's really been sort of how we've been doing this. You know, we were getting compliance. First of all, it's great that people are walking in the parks, they're jogging, they're bicycling, there's lots of outside activity. And we think that's wonderful, because you can get a little stir crazy sitting in a house all day. So it's great that people are out. And where people have been compliant and not gathering in large groups and again, in compliance with the directives and the executive orders, we've sort of like have no interest in shutting down those locations. But we've had pushback and people have been resistant. Rather than use our resources to keep going back again, some recommendations made for certain locations need to be shut down. And that's unfortunate. We'd much rather have that compliance. To the mayor's point, we're really not doing a lot of citing. If we are charging people, we're using what's called long form. And the long form basically sends it into the court system. The court system may decide what to do later at a later date. But we are at least notifying the authority of the court that people are in violation. We would just rather have people just be in compliance. And we'd rather keep the parks open for folks to do the very things that the mayor talked about, get outside and enjoy our city. But at the same time, if we're forced to close something down because people are not going to comply and they're in danger by that, then of course that's our recommendation. And so some of the locations that have been closed down were closed down just because of that reason.
Thank you, Chief Rodbell. Chief Shannon, we have a question, and I know everyone with the emergency operations and the mayor are staying in close contact with the hospital systems. And I know that Connor Health and Mayo and Banner are all working very closely and sharing resources. But the question came in, do the hospitals, does the emergency services, do the emergency services have the appropriate PPE equipment? And any status report on that? Thank you.
Yes, and if there are any of our hospital partners on the line, please speak up. I can give you the last I heard. The last I heard is the gowns, the gloves, the masks, those sorts of things are getting critically low, particularly masks. A number of our hospital partners are for lack of a better term, prioritizing how the masks and things are used. And they've really gotten very good at a protocol to receive patients and to minimize the number of those ensembles, if you will, that are required. So I don't have actual numbers. I do know that those particular things are getting particularly low. In terms of ventilators, as you hear in the news, the last I heard, which was yesterday, was that Arizona still was holding in terms of the availability of ventilators throughout the hospital systems. The challenge is that they have not met their peak yet. And so perhaps there might be some partners from the hospital systems that can elaborate on that, but that's the last I have.
Thank you, Chief Shannon, appreciate that. So we'll open up the floor for more questions from participants, please. Any more questions for the panel for Chief Rodbell, Chief Shannon, or Mayor Layne? Open floor.
You know, Mark, one thing I guess that I would add, and it was suggested by Brittany, you know, there's a lot of talk about the masks and the availability of masks and both nationally and locally, whether or not masks should be obligated for anyone who's outside. The best data so far still says that this is kind of a droplets sort of exposure. It's and a lot of the protocols that are coming out almost daily are to minimize the aerosolization or the vaporization of if you will, of impacted patients' breath and their exhalation, and so that would make sense. And so those who think they are sick or who seem to be symptomatic, they should absolutely be wearing masks to contain all of that. Those folks who are out and about, still, it would appear, and I think Dr. Fauci still supports this, is social distancing and just keeping a good distance away from folks, and obviously minimizing the amount of outdoor exposure that you can is really the common sense approach. And then obviously great hygiene personally and at home. But that's really kind of where we're at still. And this is a novel virus. They're learning a lot about it it's kind of design build. You know, they're running this train as they put track down. So as more information about how this transmission occurs comes out, we will be sure to get it to all of the members of the chamber. And but obviously check with the Department of Health Services and your local healthcare provider if you've got specific questions.
Okay, thank you. And Brittany, is there a caller or question?
Yes, Arnie, I am unmuting you now.
Thank you, and thank you to everybody doing this. So basically, I wanted to know if we can go ahead and just walk on the green belt this weekend, and if we do we need to wear masks?
If you might, Mark, there is no indication to wear masks at this time. I think, as the Chief Shannon indicated, it's a personal choice if you choose to, but there's no requirement.
Thank you.
Awesome. One other question that I saw come in, and that is, Chief Rodbell, if you could go over some thoughts for businesses if they may be having reduced hours or closed for building safety, and maybe some best practices moving into this space where they may have different hours or the building or office or store is closed.
So it's really pretty much as normal. I would think that if you're altering your office hours, if you want to contact the local police district and let them know that you'd be in the building, if you're coming and going late at night or early in the morning, you will make us aware of that. We'd love that. We'd be glad to hear from you. We're still on patrol. I've asked my folks to stop in on businesses and just reassure the shop owners and the folks that are working there that we're out there and that we're available. And I'm proud to say that we've been actually logging those contacts, and the contacts are out there, which is the good news. Our officers are speaking to the folks that are working. So I encourage the same thing. I mean, safe practices. Again, as I mentioned, crime's down, but that's not the reason to lower your guard. You should still, lock your doors. You should park in lighted areas if it's dark at night. You should still, have somebody with you, but safe social distance, of course. But if you're just going to be coming and going to your business at odd hours and you think it might draw some attention, you might want to just let us know you're doing that, and just contact the local district station. And I don't know if you know where your local district station is, because everybody knows what district they're in, but scottsdales.gov police has all that information out there for you, and contact information, who the district commanders are, who the crime prevention officers are. And if you'd like to have an officer stop by while you're there, you just dial the non-emergency number, which is 312-5000. And we've been more than happy to stop by and say hello. We're still open for business. We're still interested in how you're doing, and we're still available for answer any concerns you might have.
Thank you, Chief Rodbell. So we're wrapping up the session here in the next few minutes, and I again cannot thank you for joining us, Layne and Chief Shannon and Chief Rodbell. You have the trust of the community. We're here to help in any way that we can. The business community is very hopeful to keep as much information flowing from your positions as municipal leaders to their stakeholders and their employees and their clients and customers. So I appreciate that very, very much, and the updates that you're providing to us on a daily basis. With that said, I will still open up one more round for questions, and I would then ask if we could each panelist could give us a few closing remarks before we wrap up the session. And I'd like to start with Chief Shannon.
You sure you don't want to start with the mayor? I will defer to you, sir.
Well, I appreciate that, Chief, but I think your information was far closer and more pertinent, I think, to the overall idea of public safety and where people are geared in right now, and it's immediate. All I would say is, and maybe in part echoing if this is a closing comment, and that is that the business community has done an outstanding job of being willing and willingly accepting some very difficult issues, and understanding what kind of pressure and what kind of damage it may have done to their own personal situation and those of their employees. And we're hoping very much that they can be made whole, or at least close to it, with some of the CARE Act's remedies on that. So that's an important factor that we need to move forward with as one of our first parts of recovery, is to make sure we get that Recovery Act distributed as it should be, and to bringing back some great businesses that have served our community very, very well for a long, long time. So I just think we have a great community, and I think everyone's doing their part to make sure we get through this as best we possibly can. And I want to thank the Chamber again for having this get together, because it's all about communication for us.
Mayor, to tag on to that, it was just before Christmas, somebody asked me just about working here in Scottsdale, and I came here very intentionally about 10 years ago, a little over. And the reason I came here is because Scottsdale was like the perfect confluence, if you will, of an amazing city, amazing city partners, great healthcare system, great parks, great city workers, and I really feel that more today than ever, because the professionalism that exists inside the staff and the policymakers, the mayor, the council, the city manager, really they're all doing exactly. I wish you could all sit in on these weekly briefs. It's like being in the situation room, if you will, for a very significant wartime sort of operation. It's very, very precise. There's little surprises. People are really trying to think ahead. And I think if we do that together, particularly with the business community, when this all clears and we get the all clear, I agree with the president. Honestly, I think we're going to see such a resurgence because everything will have been in place. And so I want to compliment everybody, especially everyone on the phone, for thinking ahead 2 or 3 steps, despite the pain we're feeling now. So congratulations to all of you.
Thank you, Chief. Chief Rodbell?
So I have to echo everything that's been said by both the gentlemen that I share the panel with. I came to Scottsdale 18 years ago to work here, and but my wife and I used to vacation here as a young married couple many times. And the bottom line is that this is a very unique community. There's no doubt about it. And so what we hope, and we suspect this will actually happen because we've seen this before. We've gone through some meat grinders through the years, and we hope we have the same Scottsdale coming out the other end of this meat grinder that we were going in. And I have no reason to suspect that's not going to be true, just by virtue of how we've reacted as a community. The men and women that are members of the Chamber of Commerce have been put through some real changes in how you do business, and even, unfortunately, how it's impacted your business and your employees. And when we say we're in this together, we are in this together. At the same time, the best way we can get through this together is through compliance and supporting each other. And when the time comes, hopefully we'll have things in place, as Tom mentioned, that we can rely on in the future to get ahead of things before they occur. And we are sort of trying to develop plans to deal with them. I really appreciate you taking leadership on doing this, Mark. I appreciate the leadership being demonstrated by my mayor, council, and by my fire chief and the other department heads in the city, and Dr. Thompson as a city manager. I couldn't think of a better group to go through an experience like this with. And so thank you for your support.
Thank you, Chief, and to all of our panelists, Mayor and Chief Shannon and Chief Rodbell, thank you again for protecting the residents, the businesses, helping our community as we guide through this process. We'll keep information open, and hopefully if we have a chance, we'll bring you back for another panel as we move through and look to recovery and look to how we build back up the economy and bring back some normalcy. In the meantime, as I mentioned to the participants, we're continuing this webinar series. We'll be coming back next week talking about SBA loans and participating in access to resources and how to process that, in addition to the City of Scottsdale's economic development updates and programs that they've initiated and stakeholder engagement. So if you have questions about additional programming through the Chamber, please visit scottsdalechamber.com. We'll be updating our calendar of events and updating you all on future webinars and how we're moving our programming at the Chamber to a more digital format. So thank you again to the panelists and to all the participants. We greatly appreciate you tuning in. Have a wonderful weekend and enjoy your family and enjoy the outdoors if you can, and get out and enjoy the weather. Thank you again, and this will conclude today's webinar.